Dr. Phillip Lee.
Thank you, Mr. Deputy Speaker. Can I begin by congratulating my honourable friend, the Member for Loughborough, for securing this important debate. There have been some very impressive speeches, not least of which from the Honourable Member for North Durham. I must say that the reason I have the pleasure of having shared membership with him on the Administration Committee was because very early on in my time here at Westminster, I realised there were quite significant mental health problems amongst my colleagues, and a few of them had approached me, and I went through the normal channels and wanted to know what the support for colleagues, what the level of support was, and as a consequence of that was put on the Administration Committee. And I'm now also on the medical panel as a consequence as well, and I am encouraged, actually, I must say, by the support that is there for colleagues if they so choose. I'd like to congratulate actually the Shadow Front Bench on what appears to be a decision to lead with mental health. I think it's an important decision. I think it's actually a politically astute decision, if you would allow me. And I think that the Front Bench, I think, needs to perhaps to reflect upon its goals in this area, and don't be too over-ambitious, would be my advice. The structure of this speech, I was going to reflect upon my own experience in this area, my family experience, my professional experience, and then a few brief words on GP commissioning going forward. And we'll make reference also to, I've heard mention of the police and their concerns about their involvement in this area. And finally, I will mention something about the Human Rights Act. On a family level, I think at last count there are 3 suicides in my extended family. There are a number of people who I know who have had depression. Unfortunately, a family member has recently been diagnosed with early onset dementia. I myself have had moments of, shall we say, fluctuating mood, perhaps a bit more so since I've been in this place. So I sort of feel like I have some sort of first-hand experience through my family and myself of how prevalent the problems are. But in terms of my sort of professional experience, I think the nature of this topic is it is something that you don't forget. I recall clerking in a patient who was a survivor of Auschwitz, and the following day, and remembering the tattoo quite clearly, and the following day that person was hung themselves, and the relative of a senior member of the Defence Department at the time breaking down in front of us, a quite shocking incident as a medical student. And finally, I remember a case, actually, which I only remembered having sat here listened to the Honourable Member for Strangford, of somebody who had been a victim of the Troubles in Northern Ireland, who was relocated to where I was working under the Witness Protection Scheme. And this gentleman had experienced guns at his temple, in his mouth, and etc., etc. And I was in a position to be able to help him in that case. I guess the nature of this subject, of this area, is that it tends to throw up cases that are quite memorable and quite emotive. So I do feel quite strongly about it. I mean, locally I've done my bit. I've met with Rethink. In fact, the first hustings during the general election campaign in 2010 was run by a mental health charity locally. I have Broadmoor Hospital in my constituency at Crowthorne. I've visited there. I would encourage everybody to visit Broadmoor Hospital, actually. It's a very interesting place to visit. Their recidivism rate is the envy, I would imagine, of the prison system itself. And so I do have done my bit to try and raise the profile, the discussion, the debate of mental health services. Because the reality is that this is a significant area. I mean, about 800,000 people have dementia in this country at the moment. This is going to rise, it's going to double. I mean, this is all because of ageing. It's also to do with lifestyle, depending on whether it's Alzheimer's or it's vascular dementia. The estimated cost of mental health, I mean, I heard the Shadow Bench saying a bigger figure than this, so maybe this is out of date. I've got an £89 billion cost to the economy by 2026, half of which is due to loss of earnings in the workplace. These are the significance of this topic cannot be overstated. Unfortunately, over half of people with anxiety disorders don't interact with the service. About a third with depression don't interact with the service. The reality is the services we have cannot deal with the demand being placed upon them. So God only knows what it's going to be like when everybody actually starts turning up to see me as a GP, or indeed, as I hear, me as an MP. And I fear that this is going to lead to some realism on the part of the health team at the moment, any future health team that may come from the opposite side of the bench, in terms of rationing, in terms of prioritisation of resource. I'll give you one example. I read that we're now giving fertility treatment to everybody. I'm sorry, I think if I was going to prioritise where my funding went, it would go to mental health before it went to fertility treatment. I know that's a difficult thing for people to accept if they've got fertility problems, but the reality is that you have to make decisions, and I know where my priorities would lie. As I said, I would like to move on to GP commissioning. Just some concerns which I want to address to the front bench. There is some unease, I think, in my profession about commissioning of psychiatric services. More so than you would have of commissioning of diabetes and of hypertension or any other cardiac service. In the recent poll that I've seen, about 70% expressed quite significant concern about this. I want to flag this up. I mean, I think in my experience, most GPs don't get a lot of psychiatric experience when they're training. I happen to do a post working in depression and dementia as a junior. Quite a few don't, and I think that needs to be borne in mind in this area. Maybe we need to look at training in the way that my honourable friend for Totnes referred to earlier. I think that the reality is that the commissioning of mental health services is complex, it is difficult, and I think we need to be sort of cautious in this area. I've been supportive of the government in broad terms on the commissioning front, but psychiatric services is different from others. I think the other thing I would like to mention, I was going to go on to mention, was with regards to the police. I heard the comments earlier about the police force, and I know the police aren't terribly enthusiastic about getting involved in acute psychiatric crises. But I'll give you one anecdote. A good friend of mine attended a psychiatric hospital. Somebody had been brought in by the police. 6 policemen had brought this person in. They were in a violent state of mind. 6 policemen. And there was just this one psychiatrist, a female psychiatrist. The 6 policemen had stab vests on. She had her blouse on. The reality is that somebody has to do this work. And I really am slightly worried and slightly concerned if the police want to get out of this line of business. Who is going to be doing this? Because the psychiatrists on the front line don't have the same protections that the police do. And with reference to the Human Rights Act, the other thing I want to just to highlight is that, you know, people come into this parliamentary estate, they have to have their bags checked. Did you know that a psychiatrist cannot check the bags of a patient they're about to assess, even if that patient has displayed violent intent? So somebody can come in with a bag with knives and guns or whatever in the bag, and the psychiatrist cannot actually investigate that bag, or indeed have it searched, because of the human rights of the patient. I would very much want the front bench to look at this and get back to me. Finally, just a few questions, because I just want to take this opportunity to re-emphasise, I think GPs need an improvement of their knowledge base in this area, particularly for commissioning, and what is the government proposing in this area. With regards to choice, it's all very well sort of exercising choice as a patient if you're not capable of exercising that choice because you are profoundly depressed, demented, psychotic, etc. How on earth can you exercise that choice? And is the Minister confident in this area that the patients will get the care that they need? With regards to the welcome £400 million for talking therapies, where is this money being spent? What is the breakdown of the expenditure of this money? Is he confident that it is actually being spent in appropriate areas? Anecdotally, I'm hearing that it's not making much difference at the front line. What can be done with regards to the Human Rights Act? The example that I've given, I think we should look at this, is colleagues in another ministry. I would appreciate a response to that. And finally, with regards to a local issue, and I will close on this, the Royal Military Academy at Sandhurst is in my constituency, or should I say the parade ground and the buildings are. The residential accommodation is actually in my right honourable friend, the Secretary of State for Education's constituency. The problem is that Surrey and Berkshire borders, there is a difference in the provision of mental health care by each trust. And so you have this perverse situation where some people who are registered at the Royal Military Academy, be they personnel or be they family, are receiving different levels of care. I would appreciate a letter of response on this, either from the Minister or from the Ministry of Defence. I guess going forward with commissioning groups, we may be able to address this, but I think it's really important, particularly in light of some of the comments from colleagues reference our armed forces. Finally, can I just say that congratulations to everybody in the mental health sphere, anybody who's delivering care. You're doing it in circumstances that are often quite challenging. The doctors, the nurses, etc. need all of the support that they can get in an area which is going to be increasingly important to us as a country in the future.
Dr.